how we're going to kick off is that we're going to start with Andy talking about the program, and I think we're going to do video first, Andy.
Okay.
And then go through some slides. So for those of you dialing in, we will actually circulate the link to the video, but we're just going to play a very short video, and then we're going to talk about the key aspects of the program. We hope that works for everyone. So we'll play the video, we'll talk about the aspects of the program. Please do put in comments and questions as we go through. That would be very much appreciated. And I think without further ado, let's start.
What Equally Well does is, first of all, it starts with the premise that if you happen to have a mental health condition, that you actually have the same right to have good physical health and good overall health as anybody else in the population. And yet we know in the UK today, if you have a diagnosis of schizophrenia, you can expect to live for 15 to 20 years fewer, which is the equivalent of the average life expectancy in the 1950s in Britain. This is a huge inequality in health. A year ago, the Academy of Medical Royal Colleges produced a seminal report looking at this huge disparity in health, looking at what could be done about it, and identifying, first of all, that there was a massive amount that does need to be done across all sectors. We need some activity to draw this together nationally, to create a sense of momentum and a real ability to bring around change. We identified Equally Well as a potential way of delivering that on the basis of what the report called for. We've spent the last year talking to people individually, having conversations with organisations and people who might be interested in this, and we're now at the point where we think we need to kick this off and get started and beginning to make some progress.
There wasn't just one solution. We actually needed multiple solutions, which meant we need multiple people working at multiple levels across the system to affect change. And that's when the idea of a collaborative started. And as we started disseminating the findings from the evidence review and talking to people across the country, we met more and more people who said, I've been working in this area for years, but I've been working in isolation, and I really, really want to have the opportunity to work with others. And also to work across others, new partners. And so we started making new friends, diverse group of individuals. We've got people working across the non-government sector, the government sector, mental health services, primary care services, public health, got dentists, pharmacists, and also, and most importantly, people who've lived experience are very much at the heart of the collaborative.
So one of the great things about Equally Well is that when they looked at where are the examples of good practice, where have they seen that's really doing good things, a lot of the things they found were in the UK. So we know there's great stuff happening here, and we know that people in New Zealand with this now well-established campaign are looking to us for individual examples of good practice. But what they've done is really brought people together in a systematic way to help every organisation to feel part of something bigger than themselves. That has now begun to travel. So Australia has recently signed a charter to have its own Equally Well programme. We want to make sure that the UK is right there at the front end of this while it's becoming a global movement. So I think in the first year it's about bringing partners together. It's about agreeing some really big priority areas that we want to work on. It's setting some difficult targets for things that we want to achieve over time. And it's just about making sure that we bring together the materials we've got, so that what we know is all in one place. There's a website where you can go with lots of resources that people can begin to rely on.
Great. So hopefully that's given colleagues just a brief overview of where this has come from, where our thinking is going. And I think, Andy, you're now going to talk us through the what we're looking to do, the final program.
Yep. Thank you. And in case you wonder where that was, that's the garden in our new office area. So do come and visit us one day, and you too can share in that beautiful view. So we wanted to just discuss a number of areas today that development discussion had on the 7th of September that many people on this call were part of. And thank you everybody so much who was part of that great conversation. It's really motivated us to take it to the next level and the next steps. And thanks those who are joining for the first time today as well. So again, we wanted to learn from where it's happened in New Zealand, from the work Helen's done, And so, again, Helen can talk a bit more about this in detail probably, but the thing that felt that it really kind of added value of having a collaborative was first of all to bring together an enormous amount of activity happening across a number of organisations, many of which are very big, some local, some national, but to make sure that that really does come together in an effective way. We needed some kind of what we're calling a spine. I think what's called a backbone. There's clearly a kind of analogy there that people seem to enjoy. And particularly that would be a fairly small resource, but it would be one that brought together what people wanted to do from the organisations that were part of the collaborative. So being there for the collaborative rather than being in charge of it. So we start with actually what the Academy report recommended, which is some kind of steering group. They used the phrase committee. I'm not keen on committees, but some kind of group that brings together the partners who are investing in this and want to be part of it, to set the priorities. We at Centre for Mental Health would work with Rethink and Kaleidoscope particularly to provide that backbone function, to bring together the activities that are necessary just to make sure that the thing hangs together as a whole. So that's about coordinating activity, it's about producing resources, it's about making sure that meetings happen when they should, and that where we've identified things to do, we go off and do them. And doing that in a way that is, I guess, builds on the independence of the centre, the ability of Rethink to really bring the service user voice to the front of session, and the ability of Kaleidoscope to facilitate learning and sharing of knowledge. So we think between those three organisations, with the support of the Royal Colleges, with the support of everybody who is part of this, with the clinical knowledge that many people on the board will bring, that actually we could begin to create something quite exciting. We would then identify particular areas of focus, and we're going to have a first go at doing that today, so stand by, and that will come later, just to really identify what might we be doing in the first year. But that's a broad sense of the structure, and thanks to Vicky for producing the diagram that you've probably got on your screens now, which is way above my ability to produce.
Although Helen may recognise it from the Equally Well New Zealand structure, we've sort of turned it on its side.
Helen might recognise a lot of things that we're sharing today. I hope you find it the best form of flattery, Helen.
Oh, I just want to say, yeah, that's not an issue at all. It's about collaboration nationally and internationally. And also, I think if you collaborate, we're discovering that if you truly collaborate, you develop new things. So you've already taken the diagram into a better space. So it's great. Fantastic.
Yeah, we should probably have some sort of swear jar here, and every time we say, we borrowed this from New Zealand, and then that would probably allow us to fly to New Zealand.
I think so.
Within a short time span. So should we just pause there? Annie, do you have any particular questions on this particular approach?
Questions or comments?
Questions, comments. And I do realise that saying use the chat facility when so many people are joining on the phone is possibly not the most constructive thing to say. Also, for those on the phone, we will share the slides which we're looking at straight after this, so you will have those.
So it's John Wass here in Oxford. I think that it's really important, because it sounds to me very good so far, but it's really important to get the buy-in of the College of Physicians, the College of Psychiatrists, and the College of GPs, because although we've had several meetings with senior people in those places, I would say that at the moment the leadership has been lacking. And I think it's really important at this stage, when things look as if they're moving forward in the right direction at last, that we get the buy-in and the leadership support in those places.
Yes, this is Rini Cormack. I would like to support what John is saying. And we've begun at the Royal College of Psychiatrists. I've had a meeting with the registrar, and he is very keen to have a high-level meeting set up with the colleges so that we begin this process and coordinate better. So I think it's a step in the right direction.
That's incredibly
it's Alan Cohen from the RCGP. Not surprisingly, we'd want to support this as well. I haven't had the high-level conversations that Rini and John have had yet. The college has had its own little problems with lack of workforce and lack of money, so haven't been as involved as I would like them to be. But I will make sure that those contacts are made.
Excellent.
Just to add a bit of again, being entirely opportunistic. I had a tour of the party conferences, as one does when one works for a mental health charity, and in the course of that, I was lucky enough to meet either presidents or vice presidents of all three of those colleges and the surgeons as well. So mentioned it to them, and so again, if we can pick up the contacts that you've got within the colleges, and if we can triangulate that with some of the conversation we had at conference, we might be able to bring that together. But fantastic to if we can get everyone together through a kind of intercollegiate meeting. That would be a fantastic way to shorten the process.
And Andy, I think you touched on a core point to how you need to approach the programme here, which is this is not exclusive. That if people join it for the first time or heard about this for the umpteenth time, it's the approaches are broad.
I can't think of any Royal College that would not find this useful and to which it would not be relevant. I'm happy to be challenged on that. Some people might say the anaesthetist, but I'm not going to buy that.
No, they'll come in too, I expect, if we want them to, but we do need the core business to be done about training and education and about systems. The critical care specialists would be interested, I'm sure, in helping identify acute illness, but we need the RCN if we possibly can. So this will hopefully move on with the people that are on the phone that are from those colleges, and we can try and push it forward.
Yeah, good. Thank you.
And for those on the phone, Hannah Lockett just put a point in saying the Royal College of Psychiatrists in London is a signatory to the New Zealand Equally Well consensus. So, blimey, if they're going to sign up to one on the other side of the world, then that's a good start. Excellent. Should we just take a couple more comments before we want to move on, just to talk about what the programme is going to look over the first 15 months? But should we just go around checking in on people on the phone? Anyone else on the phone who just wants to raise any comments at this point?
David Cohen, just to support what John Was said, I think we need to move this forward at the Royal College of Physicians. I know that they're very short of policy time at the moment, so I think we'll have to work together to think of a way of doing this.
I think really important point there, and particularly when we are looking for so many people to engage, we do not want to create something laborious where we know other people have got lots of other things on. I think really important point, Dave. Thank you.
Yeah, thank you. And a good point from Vicky Nash. Thank you. That we have got some very good fellow travellers from the mental health world now working at RCN, and had a conversation with Lara about it, and we'll follow that up. They've got new leads for mental health. Karen Brown, who came to the round table among them. So I'll pick it up with Karen in particular.
Is that sort of a deliberate infiltration strategy?
Yes.
Andy,
yes.
Sleeper cells.
This is what we do in the mental health world.
Hello, it's Paul Rowlands here. I'm just, I suppose it's how there seem to be expressions of really kind of goodwill from all the Royal Colleges. It's just, I guess, what's the process for, and at what level of the college do they give a commitment to being part of this? Now, Wendy Byrne came to the meeting that we had a month or so ago. And I understand from what Reni's saying there that she's had some meetings with Adrian James. Where does it go through the college to get that sort of sign up? Presumably there was a way that they got onto the New Zealand one, but how did we get it onto the UK one so that the college is there as a signatory to this? I mean, I speak as just somebody who's a jobbing psychiatrist now who's involved in the college, but I've not got any official position in the college.
No, it's Rini here again. I haven't got a position either, but being involved with the report at such a significant amount of time like you, I really want to push this forward. Adrian James, our registrar, has given a commitment to arrange a high-level meeting with the colleges to get them to get together and work out what to do next. And he also wants to move this agenda through the Royal College of Psychiatrists itself, through all the departments. So I'm fairly confident it's going to happen with the leadership, not at presidential level, but at lower level, like at the one step down, or one of the senior officers. The Dean is also interested at the Royal College of Psychiatrists. We can have this conversation not with so many, but I think it will happen. I must say I was a little concerned if we were relying on presidential levels because they're so busy. But I think it's going to happen below that level.
Who is the gubernator of the academy at the moment? Because that was the emanation of the report, and it ought to be that that person is involved. Is Sue Bailey demitted, hasn't she?
Mm.
Yeah, I think Sue finished her time as president of the academy, and I think that.
So who's now the president?
But I don't know, but we'll find out.
Let's follow that one up.
We need to find out and engage them, because this, theoretically anyway, emanated from the academy.
Yeah, we'll follow that up, and Sue will help us, because obviously she is the immediately past president and the trustee at the centre. I think if we've got people like Adrian James and Kate Lovett behind us, we've got a very good chance, because they're people that get stuff done. We know them very well. They will, I think, really help to move things on. And as you say, you're bringing it to a level where people can make decisions, but aren't having to do absolutely everything. So that's really encouraging. Thank you very, very much.
And we're going to come back to how people can get involved a bit later on. I'm mindful of time, so I might move us on now. But again, if people have got any questions, do hold on to the chat if you're connected online. Sandy, I think we're going to talk about first 15 months.
And is the timeline on the screen for those who've got a screen?
Yes.
For those on the screen.
Okay, so we thought it would be useful to just map out what the first year or so might look like. And we're taking 15 months pretty much from now. So between now and the end of 2018, roughly, plus a bit more. And we wanted to say, well, what might this look like in terms of building, particularly that need for a business case for people to invest in this? What might we be able to do within that period of time? And I think thinking about process, the thing we felt that was incredibly important, and it came out of the round table discussion, is we do genuinely need to co-produce a charter. We need to agree what the principles are. We need to agree what the ambitions are. And we need to make sure that sense of ambition and principles is produced by people with both personal and professional experience in this world. We've got a great tradition in the mental health world and a fantastic track record, particularly in Rethink, but also more broadly around the sector, in genuinely co-producing things rather than just consulting with people who lived experience, as so often happens in other areas. So the first job really is to make sure that we have agreed what people are signing up to. Mm-hmm. And then beyond that, having worked on that, obviously there is then a quite strong job to do to get out there into the world to get people to sign up to it. And again, building on what Helen's done in New Zealand and what's now happening in Australia, there are literally hundreds of organisations that could sign up to this thing. There's so many organisations in the mental and physical health worlds and around it as well that have a part to play. Then I think there's a job to do to get organisations to think about, well, what's my bit of this? Lots of people have come to us and said, well, we haven't got much money, but we really want to support you in kind. So what are your pledges going to be? What are you as organisations going to do as part of an Equally Well collaborative? What's your part of it? Only you can do. So really to help people on that process, to collate those, to bring it together. But of course, the whole point of this is to be more than some of the parts. So I think what we want to do is think about from those priorities, and we're going to talk again a bit about priorities in a minute, but from the priorities everyone's got and the pledges people have made, what is the crucial thing that we as the centre of this can help to produce for you? So are there particular areas we need to look at evidence? Are there areas we need to produce briefings on? Are there events that we need to hold to bring people together about a particular topic? We thought it might be useful probably to have a single event in about February time, depending on how well it goes, to bring everyone together to share some of those things and to really kind of build it out for something that's exciting and interesting. Over the course of the year, you'll notice we have a web page. We're looking at building a small website that would be the Equally Well in the UK website. We've got a Twitter handle. I'm sure some of you have noticed that already. You may even have started following if you haven't read. We've had it for 24 hours now. And so just building up the resources over the course of the year so that by the time only this time a little bit later, we've actually got started, got visible proof of this happening, and we've begun to identify how are we going to make it progress, how are we going to deliver this. So I hope that gives some indication of what our thoughts are. I'm really keen to have a discussion whether what we've missed, what seems ridiculous, over ambitious, over to.
I did. There's one thing that I wanted to point out. So for those of you on the phone, we've done an indicative timeline, which suggests that the action areas that we're aspirationally aiming for about 3 in the first 15 months. We haven't defined what those are, and as Andy said, we'll talk a little bit about the priorities that came out of the September meeting and how we decide which of those drive these. I think there's probably also some lessons to learn from the ones that have already run in New Zealand and that Australia are picking up, because we put them down as kind of an initial start that will stagger them, but they may go on longer than they're in the indicative timeline, which is why it's indicative. But what we'd like to see is this kind of chart measuring what we're doing and actually demonstrating that we can get some things off the ground in the first year, which I think could help with that buy-in element.
Thank you very much. And there's a lot of detail on this slide. Again, we will be sending them around so you can fall over them in great detail. So Andy, just to recap, I think you're saying sort of 3 main areas of focus for that for the first 15 months. Firstly, there's co-production of the charter, which includes clearly what people are actually signing up to and actually what they're sort of putting in whatever form that is. That's number 1. Co-producing the charter. The central team is producing a web resource with information and briefings and case studies. But again, rather than yourself and colleagues start thinking what might be nice, that being a co-produced process. And then thirdly, you mentioned potentially a national event to bring partners together to share good practice and agree priorities for the future. So charter, resource, briefings, information, and then the national event as well.
Easy.
Oh, do it by lunchtime. Yes, Sarah saying, can we email you the slides? Yes, we'll do that. We'll email all the slides just as soon as this is done. We take quick feedback, reaction to those 3 focus areas for the first 15 months. Again, if you can put in chat stuff, that's really helpful. But let's first of all just go to people on the phone, got an immediate reaction to those areas, and particularly what resonates with you, and thinking, yeah, that's absolutely where we should be starting. So let's start on the phones.
It's Philippa here, Philippa from Rethink. Am I the only person here? Presumably, I haven't heard a Rethink voice. I would just like to say I'm not in the position to exactly say what resources we'd be able to offer, but in spirit and everything else, we're absolutely with this. And as someone mentioned earlier, we do have a lot of experience around and expertise around co-production. So very, very happy with that.
Fantastic. Thanks very much.
Yeah, thank you. And this is something I've been discussing with Danielle in particular for the best part of a year, and I know Danielle is absolutely behind this. And I think we're really kind of seeing Rethink as the people who lead on the co-production elements with people who have lived experience in this.
We have a wealth of information already, and we have the techniques to get more.
Yeah, brilliant. Thank you very, very much.
Thank you. Other comments, questions, ruminations from those on the phones?
David Cohen from the Royal College of Physicians. I said at the previous meeting, I do think it's important to find out where we are at the moment. And I think audit has been a critical tool for the RCP in improving standards. It would be very helpful if our RC Psych colleagues could find out whether there are any audit measures whatsoever of physical health and mental health patients, and also what audit tools are available. So firstly, we can see if there is any data out there already, But secondly, we can work out how to introduce audit data to give us a baseline based on what psychiatrists are already doing.
David, I can answer on that. There is a national audit of psychosis, which is run on over several cycles, and these have been part of national sequence with trusts having to return data. What is evident is that there's a huge variation across the country, and that actually there are exemplars of outstanding practice, and there's also organisations that are very much trailing. And I really like the idea of events. I would say events plural, sort of regionally based, perhaps sharing good practice. And because, for example, say within the East Midlands where I work, I'm aware of people that have been able to do outstanding practice around the metabolic and physical health monitoring around antipsychotic medication, and I'm also aware of areas that are just doing it pretty hopelessly. And the problem with the national audits is that they take the temperature, don't they? But if things don't change, if there's no intervention to change things, then you repeat the audit 2 years later, and it might have changed a little bit, but it's not changed substantially.
I accept that, but it means that at least there is some data out there.
There is data out there at a trust level. All the trusts, the big providers, have that data for their services, and NHS England has got that data nationally and is able to generate really good charts for that. We've just done a webinar around this, which might be worth sharing with the group. But Sarah, is that something that could be shared? Is it out there yet? The webinar that was done, which just ran through some examples.
Yeah, we can. It's out there with some regional teams, but not all. But we should be able to share with this group. And just to say, we're working hard to try to get the Sequin results published for all 3 years. Still something we're desperately trying to do.
Yeah,
keep you updated
and the thing that I always think when I see this sort of data as well. Okay, how do we change things? What do we do to change things? And I think that it's got to go beyond that sort of showing an organisation that's getting sort of 2% and saying you're doing dreadfully, do a bit better, to saying, well, look, actually there are examples of people getting 98, 100% here. Why don't we just kind of get them together and you copy what they're doing? You don't have to invent. You don't have to struggle around, for the next 5 years trying to work out and eventually stumbling on what a trust somewhere has managed to do. Why don't you just import it now? Cut out the. But that's about sharing and collaboration, isn't it? That's what it's about.
It's also about name and shame.
Well, yeah, at one level. But then if you do that, you've got to say, well, this is your route out of it, haven't you? You've got to say, look, you're doing really badly. This is how you get out of it. And
thank you so much, Andy. Your coming.
I mean, this is great, and there's some fantastic things coming in on the written thing as well. I clearly don't know my technical terms, but I think there is something about where there's data available that's really helpful. We know that there's some stuff around it that will be coming and some stuff that we need. I think perhaps potentially what Equally Well can do, I mean, somebody's already said there is a bit about pressure and working in a kind of constructive way with system leaders to ensure that stuff is published. But more importantly, let's go out and find the people that are doing 98% and find out why they're doing 98% and how. And then I think what a collaborative is able to do is then share that more and raise expectations. Why should it be acceptable? So I think there is a particular way to add value there. Again, I think that's something we don't have in the system at the moment, but there's potentially out.
Andy, thank you very much. Vicky Nash, thank you so much for your comment in the chat, making a couple of really excellent points. Firstly, about how we push into everything which has gone before. That this isn't just this is brownfield site, not greenfield site.
Yes.
So to be the way of describing it.
Very good.
So Vicky, completely there. But also about whether to want to do an event, just to be really clear about purpose. Otherwise, it's just usual people talking to themselves.
Yep. We don't want to do Groundhog Day.
I love Groundhog Day.
I love Groundhog Day too, but I go and watch it on video. Experience it firsthand.
You've heard it here first. It's about recreating Groundhog Day.
Vicky, also give a great link into the priority action areas, which if you're on the web chat, on the web, you can actually see. If you're on the phone, you can't. There is a voting facility after this session, which we'd like you to go have a look at these 12. Paul, I think you'll be quite happy to hear that creating baseline data on early identification of physical health needs is #1 on the list. So I think those of you at the session on the 7th of September will recognise these. And what we want to do is we're using that as a starter for 10. As we've said, to try and be manageable in the first 15 months, we probably need to pick 3 as a priority. And you guys get to be the initial guinea pigs of helping us vote to try and identify which ones have the sort of most interest around them.
You get more say than everybody else.
Yeah. Yeah.
First and equal.
Vicky, thanks so much. Really good to move us on. We've got about 17 minutes left before we get on with our days, and Helen Lockett needs to go to bed. So just to recap, we're talking about sort of three modes of the programme: the charter, event, or events. I think we probably need an event in, let's say, Wellington, just to properly get the museum experience.
I think that would be entirely reasonable.
Right, okay, we'll see about that. So the charter, events, and also these resources.
Yeah.
And then actually, what you'll see on your screen if you're joining by web is, as Vicky says, these list 12 potential priority action areas. So using those means to what we really want to focus on in terms of the topic area in the first 15 minutes. We are not going to go through them now. What we would like people to do, and again, we'll send these slides around, is to actually just reflect on those and to pick 3. So if the programme in its first 50 months was only going to do 3 things, which 3 things would those be? If we can start mulling now, and do take it away afterwards, and then you can place your votes, and then we'll take that as sort of our starting point for where those priorities sit. Hopefully that's all clear in terms of what we're asking you to do with those priority action areas. I just see, let's just take some further reflections both on sort of how the programme is going to operate and what it could focus on. Anyone else sort of on the line wanting to come in at this point?
Really cool, Mike.
Just come in with something from Rethink. I was just, I'm not finding it terribly easy to hear, but so correct me if I'm wrong. I thought I'd be hearing a bit more about how we produce the economic case, or has that been discussed? There must be lots of data around that, and more that can be assembled, and more perhaps that can be collected. Economic case for looking after physical health and mental health, obviously.
That's a really important point. Thank you, Philippa. And just to respond to that, when we were producing economic evidence for the mental health task force, we did have a look at the economic evidence in this area. It's not strong beyond smoking cessation, and I think it's an area actually we need to properly focus work on to really build that economic case. The human case is perfectly obvious and straightforward, but I think we do need to build the economic one, and that would be something we'd be very keen to do. I don't know whether it is within Equally Well, because I think it's a very serious piece of work that actually needs probably to be done quite seriously. So I think within that field potentially.
Philippa, thanks very much. I think Irene, you wanted to come in.
Yes, I just really wanted to place the benchmarking, the audit within the professional group. Something that they need to tackle. As Paul has said, there is some information out there, but I think we need a public health agenda as well, the smoking and as well as the ones that are already done. And if we have a good review, I think it will help to focus the professional group. And I would also say for your charter, please feel free to take what was in the Academy of Medical Royal College's report to use to boost your charter up, or just as a foundation, because that's one of the reasons it was written, so people could use it afterwards.
That's really helpful. We won't start from scratch. We'll start from where we are again, brownfield rather than greenfield. And what's really interesting is I'm seeing lots about public health here, which I think is great. This is very much about prevention as well as treatment, and I think that strong public health principle will be helpful.
Yes. Thank you.
Andy, thank you very much. I'm going to give you just a chance just to reflect on, we've got 30 minutes left or so, and we'll come back to people for further questions in just a second. But just, we talked about building economic evidence in this field, and but of course there's also the business case of people actually getting involved in equally well. So if people on the line are sitting there thinking, how do we show the benefits of it? What's your thought?
I think this is an area where equally well is a compelling way of pooling resource. We've got a lot of organisations that are stating this. Many are on the call today, but there's many more. If each put in a relatively small amount of resource for the size of their organisations, and that can be resource, financial and human, or other, we can achieve an awful lot more together than we would work effectively. And I think it really talks to the Academy's kind of position that what we need here is coordination, what we need is collaboration. And I think equally well presents an incredibly cost-effective way of doing that. We're looking at a relatively small resource in a central spine, which would allow us to achieve vastly more just by bringing that knowledge and understanding together, and just, I think, again, picking up what Helen was saying about that role of controlling and encouraging progress. For a tiny amount of resource relatively, I think we can have a nationwide impact. And yeah, it feels like this is something lots of organisations have within their priority areas anyway. It's in the 5-year forward view for mental health. It's something that people need to make progress on at every level. So I hope that people will feel this would be a good investment. And of course, the more people who invest in it, the less it's to invest.
Okay, and we'll come back to the thoughts in just 1 second. But can I just push you, just using Chair's prerogative? So yes. Let's think we're back here in 2 years' time, hopefully with better functioning laptops.
Yes.
What will we have achieved? What will people be able to point to and say, this happened because of the programme, which really could happen?
I think, first of all, that things that are happening in 1 or 2 places at the moment are happening in a lot more places. Fundamentally important. Then we've got a clearer sense of where we're going, so we're not having to guess about where we are and try and kind of look around for bits of data. And I think that there is a real sense that this is something that has energy behind it, that there is a shared belief and understanding, that in local areas, service users and professionals are coming together much more effectively to bring things on. A lot of the debate about physical health has got stuck in that difficult issue of smoke-free rules. And it's become a rather difficult, almost confrontational issue. We need to find a common ground. And so I think in a couple of years, with this function that we're looking to provide, we could help to make progress in that area. The long-term goal, of course, is to reduce premature mortality. We're not going to see that in 2 years, lovely as that would be, but we might see progress in terms of numbers of people smoking. We might see progress in terms of availability of the health checks, whatever the priority areas in terms of topics are. We may in those begin to see the dial beginning to turn.
Brilliant, Andy. Thank you very much. And Alan, really nice point on the chat. Thank you. Saying sort of whatever priority points you agree, they should have specific endpoints that are achievable, that we can demonstrate the effectiveness of collaboration.
Yep.
I think we'd say tick, 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 tick.
Yep.
The other thing I'd like to say, Vicky made a comment a little bit earlier in the thread around where this goes, and I think it kind of leads to Philippa's point as well. Gregor mentioned in the September meeting that what he wanted to see was a kind of business case and a plan. So part of this session today is about how to inform that business case, and a draft version of that should be completed by next week, which we can send out to sort of share and have something to bash around with, to start to take us down that route. And again, I think, Alan, really good point. You've kind of read our minds. The point of having priority action areas is to help provide some measurable benefits and tangible endpoints to those, because it can be quite amorphous, and it's about trying to kind of nail the jelly to the wall.
Yeah, I mean, all 12 of the things that we've identified are good things to do. So in a sense, if this has longevity, it's about saying, well, we'll do the first 3 in the first year.
Yeah.
But we need to know when we've done those sufficiently so that we can move on to focus on other things rather than getting stuck in a rut.
Although that said, if we found enough money to do them all, we'd do them all.
Yeah, absolutely. We could do everything if we had sufficient funding within reason. But there is also something about being focused, because we're asking too much of the system. Yes, we'll end up crashing it, rather like the webinar technology. So three things at a time. Rule of three.
I think,
Alan,
if you're going to look at these priority action areas to have a specific endpoint, you might need to rephrase them slightly so that they do become measurable. Because something like improving training actually doesn't mean very much. You have to be much more specific about the way that the priority areas are being described, and therefore what their endpoints are. So I think there's a bit of work to do on the priority action areas to get them into a form that will allow us to measure their effectiveness in a relatively limited period of time.
Really helpful, and I think one of the reasons for having a meeting in February-ish, that's a new thing, February-ish, is once we've identified priority areas, is determining something that's smart. And again, get groups of people together with expertise in these areas to say, well, what can we realistically do? What can we measure, and how will we know if we're doing it well, and really make those much tighter than the
We've got 6 minutes left, and we are going to finish on time so that people can get on with their days/night. So just to turn to sort of how Andy mentioned sort of how we're seeking to collaboratively fund this, and this is something which we've been thinking a bit about as LiveScope more generally. We're going to be, we've developed a website, a new approach to collaboratively funding projects, which we imagined to be called Collaboration Funder. You can have a look at the website, it's collaborationfunder.org, which is where we're going to be, in effect, posting the Equally Well project with details about what we're seeking to do, how we're going to be doing it, the total cost of the whole thing, and then providing a range of different ways which people can get involved and support it, whether that is financially or in kind and other means. So very much as Andy said, the more people involved, the per person cost comes down. So we'll put all the information up on that website. We will send you a link so you've got it. I think what we'd really appreciate from people at this point is both sort of to think about how they could sort of support the programme in that broader sense, but also sort of to absolutely keep on this line of conversation about how do we make this programme as effective as possible, and how we then generate smart objectives, how we are ruthless in terms of how we prioritise, so that we all know that everyone is going to have, in some very bizarre organisation, finance directors and people sitting in hierarchical management chains who don't like spending money. And so a lot about this programme is about how we can really show the benefits of doing it in this way. So key action there is that on Collaboration Fund, we'll send around the link, we'll be posting this very shortly, and that's sort of the next step in terms of how your organisation can get involved to support. And just add on that.
And where you feel that it would be useful to have an offline conversation with us, to maybe kind of seal the deal with senior colleagues or finance directors, then we're happy to have any of those conversations offline to discuss ways in which that support might be achieved, whatever would be helpful, really.
Excellent, Andy, thank you. We have got 4 minutes left, so just going to have any final, very quick reflections. I'll say if you've got questions, email us afterwards. We're not going to be able to get into detailed question response, but any final, very quick reflections for those people on the dialing in first?
Can I make a point? It's Philippa again from Rethink. I'm very pleased to hear the bits I've heard about co-production and involvement of service users. Could I just make a quick plea that whenever we talk about involvement of service users, we are talking about carers as well, who can speak up on behalf of service users and also have their own voice in this.
And their own physical health needs as well, which are sometimes compromised by being a carer. So thank you.
Exactly. And can I say, if I leave quite suddenly in the next 2 minutes, I'm going to the Institute of Psychiatry to do something highly relevant, which is research on the role of vitamin D in psychosis. Thank you very, very much for having me.
Philippa, thank you very much indeed. Any other final comments, reflections just on the phones? Okay,
I'm not on the phone, but I wanted to say how impressed I was with all the work that has been done since the last meeting. It's very reassuring to see actually some movement now, and we just got to make sure that we build on the momentum that this is generating. Andy will know how much I've been annoying him and hassling him to try and do this over the last 6 to 9 months. Things are happening now.
There's John Wass here. I entirely endorse Alan's comments. It's really nice to hear it moving forward, the prospect of a meeting in February. And I think that we've got to engage the senior people that we talked about earlier by then, so that we can report their support.
Agreed. It'd be nice to actually get people formally, get the presidents of the college to actually turn up and sign something, as with other charters, on a day like that.
Well, it will look like when they're signing bills into Congress in America, when the president signs a big book, and there are some great memes around of Donald Trump doing that, but we won't go down that route. I should say that one of the reasons we're getting some momentum now is the generosity of Kaleidoscope in offering pro bono days to help progress this. Richard and Vicky have been absolutely amazing, and not just with the technology, but with really pushing us to think creatively. So it's very much tribute to both here that we're now beginning to make this fantastic progress.
Not at all. No, it's absolutely what we want to be doing. Any reflections from those on the line, either by computer or phone? Excellent. Thank you. We're going to end now. It's 9:59, both UK and New Zealand time. Just to say, you'll be receiving an email within the next half an hour, just recapping exactly all of those next steps we asked you about, particularly about voting on the priority areas and what's going to be happening in terms of funding nature of this. I think our final request would be, if this has sort of sparked thoughts, ideas, suggestions which you haven't managed to get in either on the chat, and we'll be going back to all the chat comments, thank you very much, or by voice, please do email us afterwards. We'd very much like your views. It is 10 o'clock. Vicky, anything final from you?
No, thank you very much. Looking forward to seeing those survey results come in.
Excellent. Andy?
Only just to say thank you again to Helen for staying up late and working till goodness knows when. Really particularly grateful to have you on this call.
And Helen, you put in the chat, it's amazing how fast you're progressing this now, which I think we can probably put in size 170 million font.
That's going on the website.
On the website, great, good.
And the Twitter feed.
Again. We're going to end this now. Thank you very much, everyone. Hope you have a really good day. Working on this as we go forward.